So we wanted to bring everyone an update about our system, where we are with COVID. We recognize that nationally we are hearing that cases are starting to flatten or trend downward. That is not necessarily the case here. So we wanted to give you some context behind that, not trying to be alarmist, but just share with you a little bit about why we're not necessarily seeing those same numbers here in Utah. And then we wanted to just give you a general update about our system and where we are with COVID, answer any questions you may have. So with us today, we have Dr. Russell Vinnick, Chief Medical Operations Officer at University of Utah Health. We have Dr. Elizabeth Middleton, who's an Assistant Professor of Medicine in our School of Medicine and the Associate Medical Director of our Medical Intensive Care Unit. We also have Cornelio Morales, who is a healthcare assistant in our Medical Intensive Care Unit. He's most definitely on the front lines of COVID care here in our hospital. So to kick it off, Dr. Vinnick, I'm going to turn it over to you to give us a brief update about where we are right now with our COVID cases.
Good morning, everybody. Thanks for joining us. Wanted to give you an update of where we stand, at least from our perspective at U of U Health, and then obviously happy to answer any questions. We will send some slides out later, and I'll be referring to some of the data that we have in our slides, but I'm not going to show you any slides right now. So, from a national perspective, as Kathy mentioned, we've seen a significant over 30% decline in COVID-19 cases over the past several weeks. However, when we dig into this a little bit deeper, the majority of that decline is in the Southeast. States like Texas, Florida, Alabama, Louisiana, which had a very rapid increase in cases, now have seen a rapid decline in cases. As we move further west to states like Arizona, Utah, Nevada, Idaho, the story isn't as promising. We've been watching Arizona very closely because their schools opened about a month before schools in Utah opened. And if you look at the curve in Arizona, they seem to have reached a peak and a plateau, but they have not seen a downward trend in cases in Arizona either. What we've seen statewide is a little bit of a peak a couple of weeks ago, and then maybe about a 10% drop in cases, but they've really leveled off over the past couple of weeks, and maybe even a slight upward trend. We track this at the University of Utah with our own data from our own testing centers, and what we have seen over the last 3 weeks is a gradual upward trend in new cases within testing that happens at our testing centers, which is a limited geography, but what we've seen over the past 22 months is typically when we start to see an upward trend in our data, it starts to get reflected in the state within a week or two as well. So we are pleased the cases aren't going up, but we're also being very cautious because cases aren't going down either. If they are, potentially going up slightly. When we look at hospitalizations from a state level, the state has been running close to about 600 patients on a daily basis that are COVID-19 positive and occupying a bed. As far as the ICU census, as you all have probably seen, that's running around 230. These numbers are as high as the peaks that we saw last December and January. The big difference, as we've talked about many times, is a strain on healthcare personnel that we don't have nearly the staff to take care of these patients as we did back in December of last year, and that has caused significantly more strain than what we've seen in the past. What I can tell you is we coordinate with every hospital system in the state. In almost every day over the last week, we've been getting pages from hospitals that have had difficulty placing patients. And we try our very best. Every hospital system in the state is doing as much as they can, but there are patients that wait 12, even 24 hours in small community hospitals, some of which don't have even a respiratory therapist, never mind an intensive care specialist. And so we get these patients, but care is suffering throughout the state due to the situation of how significant patients are, and they're very ill, and we can't always get to them when we want to get to them. So the main reason we're bringing this to you is because the holidays are coming up. We certainly saw last year as the winter started, we saw a significant increase in cases again. We don't know if that's going to happen this time around, but there are things that people can do. The vast majority of hospitalizations are in patients who are unvaccinated. It's not too late to get a vaccine. Even if you get one today, you'll have some degree of protection by Thanksgiving. And this is what we've seen in the past, is these holiday gatherings tend to promote disease transmission. So please do what you can, get vaccinated today to help protect yourselves, your loved ones, and the community.
Dr. Middleton, I'm going to turn it over to you now as someone who is on the front lines caring for critically ill COVID patients. What have you been seeing these past few weeks?
Thanks, Kathy. Thanks, Russ. I want to reiterate Dr. Vinnick's point is that the ICUs are full. The reason that we cannot take more patients is because there's a significant limitation on staff. We don't have the ability to surge up to an additional ICU as we did this past year. And because of that, we cannot take as many patients from these smaller communities that do not have the resources. That means that smaller communities are suffering. There are delays in patients coming to us, and they become sicker in that period of time. So our ability to intervene within a short, early window is significantly limited. Again, prevention is the best thing that we can do for this, and getting a vaccine to get some preventive measure in place before we spend more time indoors, more time together with loved ones and larger family gatherings, and preventing the spread to people and preventing the suffering and toll on small communities is really essential. What we see every day is that our ICU census is continually full. We have not dropped below 30 patients. Our medical ICU can take 25 patients there, and then we have brought in an additional team to cover other patients that are in other ICUs. We have not dropped below 30 for more than a few hours as we continue to struggle to provide care for the sickest of the sick. Additionally, the acuity of the patients, how sick they are, is much higher than it was last year, because we cannot take people that may just need a little bit higher flow of oxygen but not necessarily a ventilator yet. The people that have severe respiratory compromise or severely low blood pressure will come to us, but these are sicker than even what we were seeing last year.
Thanks, Dr. Middleton. Dr. Vinnick, a question for you. So as you mentioned, in the Southeast, cases are flattening or going down, not necessarily the case here. Is one reason that we share a border with Idaho, and cases there are still very high, and we also, between Utah and Idaho, have family members, friends, that sort of thing? Can you talk to us a little bit about that?
Yes, what we've seen, if you look at the trends in the country, is those states that had a very rapid rise, like they did in the Southeast, are also having a very rapid fall. What we've seen in the Mountain West area is our rise wasn't as quick, and so it's plateauing and not coming down nearly as quickly. Now, what I can tell you is we certainly do have a lot of patients here from Wyoming, Idaho, and Eastern Nevada, and this is our community. We are the academic medical center for this region, and these hospitals rely on us to help take care of these patients that they can't take care of. So we in Utah are not isolated. Still, the majority of the patients we have in our hospital with COVID came through our emergency room, but we do have a significant pressure that's come from surrounding states, which is affecting us because every state in this Mountain West is struggling with the COVID cases.
Okay, thanks, Dr. Vinnick. And a reminder today that we do have Cornelio Morales available to answer questions in Spanish for our Spanish language media partners. Dr. Middleton, a question from one of the reporters: are people sicker because of the Delta strain? Do you feel like your patients are sicker now than they were perhaps earlier on in the pandemic?
That's a little bit difficult for me to answer because the patient population I see is biased. I'm seeing only the critically ill patients, so those with severe respiratory failure, those that are on a ventilator, non-invasive, more than just nasal cannula oxygen, and are needing potentially vasopressors to support their blood pressure. So the population I see is sicker in general. What I do see is a trend in younger folks. So people in their 30s, early 40s, some in their 20s coming to us. Also an increased incidence of pregnant women coming to the ICU than we were seeing last year.
Thanks, Dr. Middleton. And another question for you, Dr. Vinnick. Is the lower number of, is our lower staffing due to attrition, more resources available last year from outside sources? What do you attribute that to?
So there's a lot of factors that are going into the staffing. First of all, when we had the surge back last fall, a lot of our normal business was not happening. And in many ways that was good because it meant we had staff to take care of patients, but in many ways that was bad because people did not get some of that preventative care, those colonoscopies, mammograms that were able to detect cancer at an early time. And so now we've seen people that are getting hospitalized with later stage cancer, and our Huntsman Cancer Hospital is extremely full. So that's one factor. Another factor, as you'll read nationally, people are leaving the workforce. And that's not just in healthcare, but it's also very pronounced in healthcare, in part because people are so strained and they've worked so hard for so long and they're mentally exhausted. So that's the second factor. And then the third factor is contract staffing. With a lot of federal dollars coming to the states to help take care of COVID, that's created some problems. And those problems are that hospitals are now competing with contract nursing and other contract staffing, trying to get staff. And so we see some hospitals offering signing bonuses for $20,000 and paying $300 an hour for nursing. And so that creates a very significant incentive for some people to leave to go to other states and other areas. And this is very difficult to keep up with because it also creates a morale problem when one might have a contract nurse which is making 3 to 4 times what your day-to-day people who are on the grind working create. So all of these are coming into play and creating a very difficult situation for us as well as every hospital in the state.
Okay, thanks, Dr. Vinnick. Hey, Cornelio, I'm going to start with you on this next question. I'm going to have you answer this question in English, but remind everyone that Cornelio is available to answer questions in Spanish once we get through the English portion. But Cornelio, I'm going to start with you on this question. This is from the Tribune. We've heard stories around the country of family members of patients getting hostile with healthcare workers in the ICUs, even threatening. Have you witnessed anything like that? And can you talk a little bit about that and how we're managing those issues right now? Is that a problem? Is it not? Cornelio, you're on mute. You need to unmute.
Okay. Yeah. So yeah, we have some cases with their family members who want to come see their family in the hospital, but they're not vaccinated, and we don't allow them to come to the hospital. And then they got upset, and then just get mad at us because we don't let them come in, but we just ask them for approved vaccine. And then if you don't show them, we can't bring it to the hospital to see the family. And then they get some kind of agitated and then mad to us, and then we call the security and then it gets under control.
Thanks, Cornelio. Dr. Middleton, do you want to speak to this too, since you're often in the front lines?
Absolutely. So family members become quite distressed. Oh shoot, I just lost my earpiece. become quite distressed when they're not allowed into the hospital to see their family members because of an unvaccinated status. There's also a huge degree of emotional strain on the family when they cannot see what's going on with their loved one. They can't appreciate all the work that's going into support them and help them. There's a level of mistrust at times, and it takes a while to build a therapeutic relationship with the family. That takes hours of discussion, reassurance, communication, involving, FaceTime, iPad communication to let them know that you're in the room, you're present with their loved one, you appreciate what's going on. They often come to you with suggestions from things that they've read on Facebook or the internet, and these non-standard of care treatments that they want you to, quote unquote, just try, which is not how we practice medicine. And so trying to discuss with them, reassure them, let them know that you do have their loved ones' health and best care in mind, and that is what you're trying to provide, takes a ton of time, a ton of provider time, and that too has led to, I think, this burnout and emotional drain, because imagine doing that for 30 plus patients every single day.
Thanks, Dr. Middleton. And I'm gonna, the next couple questions are about the holidays. So I think both of you could answer this. I'll start with you, Dr. Vinnick. You touched on this earlier, but what impact do you think Halloween, Thanksgiving, all the holidays coming up, what impact do you think? Can you predict that, or do we know?
Boy, this is really hard to know what the holidays are going to bring. If we look at this time last year, our case counts and hospitalizations were significantly lower and headed upwards. And so we're very concerned about what it will bring. We certainly know that family gatherings is one of the biggest places that COVID gets transmitted. And so if we have another curve like we did last year, we'll all be in a lot of trouble. We are hopeful that maybe we are reaching that point where enough people have been vaccinated and enough people have natural antibodies from previous infection that it won't be as significant of an uptrend as it was last year, but we just don't know. This is unprecedented. We've got a new variant that is much more virulent, it's easier to catch, and so we don't know, but we're concerned, and that's why we're pleading with the community, please get vaccinated, because we can stop this disease in its tracks.
And Dr. Vinnick, while I still have you there without your mask, you mentioned natural infection. There has been a lot on social media mentioned about people who had COVID, they have natural immunity and they don't need to get vaccinated. Can you speak to that?
That's a great question, and it comes up a lot. The good news is we do now have data that shows that people who've had COVID do have a good degree of protection that lasts for many months. We don't know how many months it's going to last. It is likely very variable depending on which strain they were infected with, how severe their infection was, how strong their immune system is. We know that even people who have gotten previous COVID, if they then get vaccinated, they can cut their risk of getting COVID and also getting severe infection from COVID by half. So even if you've been infected, getting vaccinated will help you and will help your family members.
Okay, and then another quick question for you, Dr. Vinnick. Can you speak to the ripple effect that people who, because of the impact on our hospital from COVID, they're having to wait for other types of non-COVID related care or surgeries? And a follow-up question to that is, can these people go to smaller hospitals that perhaps don't have ICUs? How are we managing these, non-COVID related surgeries and care episodes that people need?
No, great question. One thing that we have been forced to do at the university, and this has been going on for over 2 months now, is we've limited the number of elective procedures that we do in a day. And we make those decisions about 48 hours in advance because it's so fluid. And so we look at our schedule and we look at how many beds we have and decide how many cases we can do on any given day. Now, the good news is the vast majority of surgical cases and procedures we do don't require hospitalization. And so those cases we have not been required to limit. It's just the cases that require an overnight stay or more that we've had to limit. And the reality is we've had to cut back probably about 5 to 10% of those cases. And we do that on a daily basis. Now, a question is, could people go to other hospitals? What I can tell you is every hospital in the state is strained. If you look at our number at the University of Utah, about 30% of our ICU beds are occupied by COVID patients. We've seen other hospitals in the states, particularly the rural hospitals, where over 50 and even 60% of their ICU beds are occupied by COVID patients. Rural hospitals are taking care of COVID patients, and they've really stepped up in the state of Utah, and they only end up transferring them when patients are needing a significantly higher level of care. So even those that require ICU care, they generally will stay at the rural hospitals until they need that tertiary and quaternary care that only one of the larger medical centers in the state can care for. So it's a strain. We're doing our best. We coordinate very well with all the other hospitals in the state, trying to level this out as much as possible, because one thing we all agree to is everybody in the state of Utah should have access to the same amount of care. Now, one last question that you brought up, Kathy, is when we talk about this strain, this is not just COVID patients. We've gotten calls with people with heart failure, heart attacks, and other significant conditions, and those people end up waiting for care as well. And that's terrible. That is not the way we want to be practicing medicine. But that is the reality of this crisis that we're managing. And we have to do the best, and we're all united in the state about caring for the most people and doing the most good for the most people.
Okay, thanks, Dr. Vinnick. We have a couple questions in Spanish, and we're going to get to those in just a minute. But Dr. Middleton, I have a couple questions for you relating to those who are anti-vax and questioning science and so forth. There's, I guess, some protests planned in the community. What do you say to that, and how do you speak to your colleagues about that who are growing more and more frustrated? And as a follow-up question to that, is there anything you think, in your opinion, we can do at this point to convince those who are determined not to get vaccinated? What are your thoughts on this issue?
That's a really hard question. It's really hard with the anti-vax community, and it's hard on all healthcare providers because this is such a preventable disease, and the suffering and injury that we see both to patients and the moral injury to providers is preventable. So it makes some people angry, it makes people sad. There's a lot of feelings there. In the ICU, most of the patients that come to see me, by the time they come to me, they're scared. And a lot of, I think, what's motivated people to not get vaccinated is what they're hearing from whatever their sources are, but that's also motivated by fear. They were afraid of the vaccine and less afraid of COVID, and I wish there was a way to break through and show them that the possible injury caused by COVID is so much worse than what we see with the vaccine. We commonly get that question when we're talking to family members, like, what do you think about the vaccine? Do you think it's actually safe? My response to them is, I have not taken care of one patient who's had a complication from the vaccine. I've taken care of lots and lots of COVID patients and seen terrible things because of that. What we can do out in the community, oh, that's such a challenge. I was talking to one of my colleagues yesterday who's a primary care provider who has this discussion over and over all day long, and I don't know what to do other than, remain a trusted source for your patients and offer education and offer support to them. I mean, they've trusted you. Hopefully your patients that have been with you for years have trusted you for this long. Maybe we can continue to build on that trust and try and sway them.
Thanks, Dr. Middleton. Another quick question for you. how important do you think it is during this period here in Utah, where we still are having you know, a lot of patients with COVID? How important is it to continue wearing a mask? We have a question from Tamara Viafanu at KSL talking about the Salt Lake School District is continuing their requirement for students to wear masks through December. Do we think masking will have an impact? Will it help us right now?
I mean, it certainly worked last year. So I'm in favor of continuing to wear masks. I have my children. I have young kids who are not eligible for a vaccine. Even my older vaccinated child wears a mask, because we don't know who we're interacting with in the community, additional family members that may have a degree of immune compromise. What if your brother or sister or wife is undergoing chemotherapy and has a compromised immune system? You don't want your kids bringing that home and potentially spreading it to loved ones and causing injury there. So I continue to wear a mask out in the community. Anytime I'm out at the grocery store, anytime I'm not in my home, I'm wearing a mask. So.
Okay, and then one more quick question for you. I think, hang on, I think I'm losing my place here. Oh yeah, I know what it is now. Can you talk to us just briefly about a lot of people are aware of the fact that even vaccinated individuals can still get COVID, and they have, particularly with this Delta variant strain. Can you talk a little bit about that and what you're seeing in the hospital in terms of those who've been vaccinated?
Certainly one can still contract COVID after getting the vaccine, much like the flu, but your severity of illness is going to be much less. I have taken care of patients that have been vaccinated that do get severe enough to come to the ICU. By and large, those people have an immune compromised system. Either they're on immune suppressive agents or have an underlying bone cancer or bone marrow cancer and can't mount an adequate antibody response. And the few that have come in with quote unquote breakthrough COVID, so they've been vaccinated, otherwise fairly healthy individuals, they turn around pretty quickly. So they may come to us for a couple of days, whereas our other patients coming in with COVID, they can stay for weeks or even months.
And by that you mean the unvaccinated when you say the other?
The unvaccinated, yeah, can stay for much longer period of time than those who are vaccinated.
Okay, thanks, Dr. Middleton. Dr. Vinnick, I'm going to have a question for you, and then I think, and if we don't have any other questions in English, we'll flip over to the questions in Spanish. So for those who are hesitating to go to the hospital right now because they don't think they're going to get help, or they think it's too crowded, what do you say to them? Should they call the hospital? Should they come in if they need to be seen? What do you say to that? Do we have room?
So certainly if you are sick, particularly if it's life-threatening, things we've talked about in the past like chest pain or shortness of breath, please come to the hospital. We will take care of you. We will take care of everybody. And so I don't want there to be a question of people being turned away. That will not happen if you come to a hospital. Certainly if you call 911, the EMS will check with hospitals to make sure that they are not on divert, and will bring you to the closest hospital. And we don't want to go back to the days when people, early in the pandemic, we saw people that were dying at home with heart attacks because they were afraid to come to the hospital. So we will make a capacity to take care of you. We will take very good care of you. And lastly, please don't be afraid that you're going to catch COVID in the hospital. It is exceedingly rare to have any COVID transmitted in a hospital. That is one of the safest places you can be as far as COVID-19. It is a much safer place to be than out and interacting with the community.
Okay, and then finally, Dr. Vinnick, just once again, it's not time for people to relax quite yet, even though maybe we're seeing these downward trends in the country. Not the case here, and again, not trying to be alarmist about it, but it's not what we're seeing here. So what do you say to folks out there? So
we're hopeful to see a downward trend in Utah. It's certainly not going up at the rate we had seen in the past, but we are not out of the woods yet. We will be the first ones to be having a party when things are better. But right now we are not out of the woods. Utah Our cases and our hospitalizations are as high as they've ever been, and so now is not the time to let your guard down. COVID is not over.
Okay, thanks, Dr. Vinnick and Dr. Middleton. I'm going to have you guys hang in with us in case we get any other questions, but I'm going to turn it over right now to Cornelio. And Cornelio, there are a couple questions in Spanish for you in the chat. Are you able to see those? And if not, I'll just ask Univision to open their mic. Can you read those questions? Francisco from Univision had a question written in Spanish.
Yeah, he can ask me the question again if he wants to.
Yeah, Francisco, do you want to just unmute and ask that?
Absolutely. Thank you for the opportunity, and I'm gonna switch to Spanish. ¿Qué tal, Cornelio? Muy buenos días. La primera pregunta aquí en Univision que tenemos es con el tema de los pacientes que estamos viendo en todos los hospitales, ¿no? Sabemos que están llenos, que hay una cierta crisis que muchos no queremos ver o la comunidad no quiere percatarse. ¿Qué es lo que usted está viendo? Y bueno, ¿cómo podemos prepararnos ahora que está cambiando el clima? Hay más enfermedades, hay más gripes por ahí, hay más contagios. ¿Qué recomendaciones tiene? Muchas gracias.
Gracias, Francisco. Lo que miramos aquí en el hospital, como decían los doctores anteriormente, es que miramos muchos casos de pacientes que no están vacunados, que terminan en ICU y que requieren mucho cuidado y muchas atenciones. Y nosotros los que pedimos es que se vacunen y traten de agarrar la información correcta. La vacuna, como dice la doctora, es eficaz y hemos mirado pacientes que se han vacunado, pero menos riesgo que los que no se han vacunado. Y la vacuna sí funciona. Le pido a la gente latina que se informe bien y que se vacunen para proteger a toda la gente, a su familia que tienen otros problemas de salud y evitar que vayan al hospital con la vacuna.
Cornelio, obviamente, pues a veces no nos gusta que nos pinchen el brazo, ¿no? Que puede llegar a ser un poquito doloroso, pero ahora hemos escuchado también que se recomienda la vacuna de la gripe aunado a una de refuerzo cuando seamos candidatos contra el COVID-19. ¿Usted recomienda que estemos con las dos vacunas? ¿Es algo apropiado? ¿Es algo que nos podría proteger más para estas fechas frías aquí en el estado?
Sí, recomendamos la vacuna de la gripe y del COVID al mismo tiempo. Hay mucho personal de salud que se ha puesto las dos vacunas al mismo tiempo y no han tenido reacciones. Y sí recomendamos que se vacunen contra la gripe, especialmente como dice usted, que viene la temporada de frío. Y el año pasado en el hospital no miramos muchos casos de gripe porque usamos más las máscaras. Eso lo miramos el año pasado aquí y yo recomiendo de una forma personal que sigan usando la máscara para evitar el COVID y también al mismo tiempo evitar agarrar la gripa de otras personas que están enfermos.
Cornelio, el hecho de que el año pasado hubiese menos contagios de gripe, ¿se puede decir que fue gracias a la máscara? O sea, ¿sí nos protegió de más contagios de otros virus?
Sí, yo miré eso el año pasado porque el año anterior, cuando no estaba el COVID, nosotros teníamos aquí en ICU muchos pacientes con el flu, la gripa, y este año pasado no miramos, si acaso, un 10% de pacientes que tenían el flu, porque yo pienso que era a causa de la máscara que nos protegió con otras enfermedades.
Cornelio, cuando, bueno, los accidentes pueden pasar en cualquier momento, ¿no? Pero hay personas que han tenido quizás alguna fractura, algún accidente que no puedan recibir atención por camas donde haya pacientes con COVID-19, especialmente personas que decidieron no aplicarse la vacuna. ¿Es algo que está pasando? ¿Hay una crisis de pacientes quizás que no pueden recibir esa atención que normalmente estaba disponible?
No en la Universidad de Utah. En la Universidad de Utah, como dice el doctor, estamos atendiendo a todos los pacientes y si tienen algún problema de salud, que vengan al hospital y se le va a tratar con la misma, como si tuviera otro problema. No hacemos diferencia si tienen COVID o tienen otro problema de salud. Aquí en la universidad lo estamos tratando a todos de cualquier problema de salud que tengan. Que no se queden en sus casas. Si se sienten enfermos, que vayan a la universidad y se les va a atender igual.
Cornelio, usted que entiende muy bien a la comunidad hispana, sabe que nos gustan las reuniones y que pues vienen estas fechas donde pues hay mucha pachanga, ¿no? Hay mucha fiesta, muchas reuniones en familia. Son bonitos días los que nos esperan en estos últimos 3 meses del año. ¿Qué recomendaciones? ¿Qué hacemos? Ustedes ya lo han dicho en muchas ocasiones, pero no está de más volverlo pues a repetir para protegernos y disminuir un riesgo de un contagio.
Sí, pues en primer lugar que se ponga la vacuna. Ahorita todos, la mayoría de 12 años para arriba califican para la vacuna. Entonces yo recomiendo y nosotros recomendamos que se pongan la vacuna y, y cuando salgan afuera, pues pónganse la máscara y si tienen reuniones familiares, tratar de minimizar el número de familias si se puede. Pero lo más recomendable es que se pongan la vacuna ahora que ya está disponible para evitar el contagio y se siga y podamos bajar los casos de COVID aquí en Utah también, como otros estados.
Mi última pregunta para usted, Cornelio, es acerca de las personas que recibieron la vacuna de Moderna o la vacuna de Johnson Johnson. Sabemos que ya está disponible un booster shot, ¿no? Que es la vacuna de refuerzo, como la llamamos en español. Si yo me vacuné con Johnson Johnson o Moderna y ya pasaron 6 meses o no sé cuál sea el reglamento, ¿qué se sabe acerca de si podríamos obtener esta vacuna de refuerzo?
Ahorita se está dando la vacuna de refuerzo. Yo ya me lo puse hace 2 semanas porque nosotros empezamos a poner primero. Yo me lo puse la tercera vacuna en este caso y no tuve ni una reacción. Am, yo aquí en la universidad yo me puse el Pfizer y, y si califican para la tercera dosis, yo recomiendo que se lo pongan. Yo, como digo otra vez, yo me lo puse y no tuve ni una reacción igual que las otras vacunas. Y yo le recomiendo que si califican para el booster, la tercera vacuna, que se lo apliquen.
¿Algo más que le gustaría agregar, Cornelio? De mi parte ya estoy. Le agradezco mucho su atención aquí en Univision.
Gracias, Francisco. Y hacer énfasis otra vez en lo mismo que estamos diciendo los que trabajamos en el Departamento de Salud, que la gente latina que se vacune, todo el mundo, ¿no? Pero la gente latina que es nuestra gente, que se vacune. Miramos muchos casos de gente latina aquí en la universidad, aquí en el cuidados intensivos, que no sean vacunados y nomás dejamos entrar a la gente que tiene vacuna, que puede probar. Eso es un poquito difícil para nosotros decirles que no, porque son las reglas. Y sinceramente, cuando están aquí y están enfermos, muy enfermos, y no pueden venir a mirar a sus familiares, se siente uno muy feo, pero por eso de corazón yo le pido a toda la gente que nos escucha que por favor se pongan la vacuna, que sí, la vacuna sí funciona y usen la máscara cuando salgan afuera también. Gracias por las preguntas.
Gracias, Mr. Cornelio. We're done. Thank you so much, everybody, for this opportunity. Have a great day.
Thanks, Francisco, and thanks, Cornelio. Thanks, Dr. Vinnick and Dr. Middleton. Thanks, everyone.